Hi, good welcome, guys. Happy Thursday. I hope you all are having a great day today. And today we are going to talk about a wonderful topic. And this is the 7 hidden dangers of overactive bladder. So I'm going to talk about each one of the things, and then I would love to hear which one of these you have experienced and how they have affected your quality of life. As a reminder, I'm Dr. McJunkin. Nice to see you. I specialize in sacral neuromodulation, which is a therapy for people struggling with overactive bladder. And it's the most effective therapy that's ever been developed, ever been researched. Long term has a 93% success rate. And so that is how I help people with overactive bladder. But, I love researching this and learning more about the ways that people are suffering from this condition and finding out the best ways to help them. So in this, you'll learn about dietary changes, things you can do for sleep, all those sorts of things. And if you guys have any comments or questions, I would say jump right in. I'd love to hear them. So we are going to talk about the 7 hidden dangers of overactive bladder. And this comes right from an ebook that I wrote not too long ago and this past year. And the cover of the ebook is, and I put it on one of the little pictures, but basically it's a boat heading towards an iceberg. And all of us are familiar with the Titanic and what happened there. But I think that's really a good visual description of how people struggle with overactive bladder. So those people around you who are close, your loved ones, your friends, they might see the external aspect. They might see just the tip of the iceberg, but they don't know how it's affecting you at every single level of your being. And so we're going to talk about some of those things today. And really the impetus for this talk is to encourage you that 2024, make this your year to find relief for the overactive bladder that you suffer from. And if you have friends or family that suffer from this, make it your goal to help them as well. So the first thing, we're going to talk about 7 different things. The first one is the social and emotional impact. And so I'd love to hear from you guys. What socially or emotionally, how has this impacted you? And so there is a lot of research on this. And I see it every single day with my patients. But generally what we see is that we see people as they start to become more active, they will have some embarrassing accident. So I talked to somebody yesterday, and she was saying she went to, I think it was dinner with her daughter, and she had to go to the bathroom like 3 different times during dinner, and she just felt embarrassed about that. But she said, that's nothing compared to, I've had a few times where I actually have an accident, and it is an accident that's not contained by my pad or my diaper or something like that. And so one of the ladies, another lady that I saw, she said, she's a super active woman, travels a lot, a real go-getter, and has accomplished a lot in her life. But she says, now I just always wear brown pants. And I've heard that a lot of times, like I'm not wearing white pants anymore. But from a psychosocial impact, what we see for people as they struggle with something like overactive bladder is generally we see a loss of self-esteem. And I think this is kind of like the dying of self, where you're starting to lose control over what makes you feel like, who you are. Embarrassment, I kind of mentioned that. Decreased ability to maintain independence. I saw a lady and her husband yesterday, and she was talking about not just overactive bladder, but also bowel incontinence. And she was talking about how embarrassing that was, and that her husband had to help her kind of clean things up, and that was, just a terribly embarrassing thing, and it made her want to retract from life and not engage and go out with friends and family and enjoy all the social aspects that all of us need to be healthy. Social isolation is exactly what that is, and ultimately, oftentimes for people, this leads to depression, anxiety, more and more of a poor quality of life, and so for all of those reasons, the social and emotional aspect of overactive bladder should not be, we should never look down on that, because that actually has a massive impact on people. There's one research study that I always like to kind of quote, but it basically shows that overactive bladder is just as disruptive for people's quality of life as if they had really bad rheumatoid arthritis that was causing kind of disabling, crippling, chronic pain. So they would have trouble moving their hands, moving their legs, walking. Overactive bladder actually affected people's quality of life the same as that. And most people don't realize that. That's kind of, the tip of the iceberg. That's the iceberg underneath the surface. Okay, so danger number 2. This is a big one, and again, this is one people don't understand, but falls and fractures. And so not only is this a daytime occurrence, so the hallmarks of overactive bladder, it's known by a few different things, but the hallmark is urgency. You have a strong urge to go to the bathroom. And so you can imagine if I had a strong urge right now, I would not be talking here or thinking. I'd be like, okay, I gotta go. And I'd be out of the way and out the door trying to make it. And so you can imagine that oftentimes will increase your risk of falling and of fractures. So that's just in the daytime, but also in the nighttime. So some people suffer with a lot of bladder issues at night. That can really increase your risk of falls and fractures because you can't see where you're walking. And let's say, God forbid, that you use a cane, a walker, a wheelchair, some other supportive mechanism. If you have a strong urgency, oftentimes you just do not have the wherewithal to get there in time without having an accident and or having a fall. And so some of the things that I'll quickly tell you, one of the things that I learned in medical school is that if you were over 65 years old and you fell and fractured your hip, that there was about a 50% mortality within the next year. That about half the people would live through the next year and half the people wouldn't. And I think that number has actually come down just with some advancements and modern medicine. But that's significant, and fractures in the elderly are actually one of the most dangerous things that any of us can experience. And so if you're 65 and older, fractures are actually something that you should be cognizant of. Arranging your room, making sure things are cleaned up, have a clear path to the bathroom if that's where you need to go. And then ultimately, I'm going to encourage you guys, try and get the issue as tuned up as you possibly can. So some of the stats, over 1 in 4 adults over 65 fall in the U.S. each year. The number one cause, this is crazy, the number one cause of injury-related death in people over 65 is falls. Now, I remember when I was a kid in high school, and we had the MAD, Mothers Against Drunk Driving, and so they would bring out like this car that had been in a drinking and driving, like an accident, and maybe even people had died in that. And so MAD, Mothers Against Drunk Driving, they were really trying to encourage us, like, look at the impacts that something like drunk driving can do. Don't ever get in the car with somebody who's been drinking. And obviously that's great advice. But it's interesting because I think for the demographic, if you're 65 and older, for that demographic, really falls is kind of like that drinking and driving thing. Falls, because remember, we've always thought of accidents, car accidents, for younger people as the most dangerous thing. But actually for the older generation, falls are the most dangerous thing. Let me see if there's any more than 95% of hip fractures are caused by falling. And so, obviously I would encourage all of you guys, we don't want to have any falls. Take every precaution you can. The other thing, I'm just going to mention it very quickly, but all of us should probably be taking vitamin D3 and K2. Both of those things increase bone density, keep your bones strong. So if God forbid you do have a fall, that you don't have some quality of life or life-ending fracture. Magnesium is also another supplementation that helps in building bones. Older research used to encourage calcium for building bones. That's actually not encouraged as much anymore, and all the research shows the more calcium you take, at least in a pill format, the more likely you are to have a heart attack. So I don't encourage calcium, but certainly vitamin D3 and K2 should be something that all of us are taking. For adults, usually the D3 is 5,000 IUs per day, and K2, oftentimes you can find both of them together. So I absolutely recommend that. Magnesium, you should be taking 400 milligrams or more at night before you go to bed. There's different variations, and you can experiment with them. I take one that has all the different formulations mixed in with it. So you get some brain benefit, some bone benefit. Okay, after hip fractures, 40% of people are unable to walk independently. 60% of people require assistance a year later. Mortality, 20 to 25% in the first year. So like we said, that's kind of come down. 50% of people with one osteoporotic fracture will have another one. And 33% of people will become dependent or in a nursing home in the year following a hip fracture. So obviously massive risk for people who are suffering for overactive bladder. And again, this is underneath the iceberg. People are not understanding this or realizing how risky this condition is. Okay, number 3 is poor sleep. I am a huge proponent of sleeping better because it actually improves every aspect of your life, and because my wife and I suffered really poorly with poor sleep because we were always getting up with our daughter who has a medical condition, and we had all this interrupted sleep. Interrupted sleep is one of the most dangerous things that we know about now. And so the classic example of this is sleep apnea, where you actually have interrupted sleep and hypoxia where you're not getting oxygen. But overactive bladder actually is extremely dangerous, not only to your overall health, your bladder, but I'm going to list some of the things that poor sleep leads to. High blood pressure, heart attacks and strokes, weight gain and obesity, diabetes, depression and anxiety, faulty brain function, memory loss, immune system deficiency, decreased fertility, and psychiatric disorders. So poor sleep affects almost every single aspect of your body. The other thing that I love to mention is during the different stages of sleep, our brain actually shrinks a little bit and cleans itself out. And so if we're not getting into the deep sleep each night because we're waking up 3-4 times a night to go to the bathroom, all of a sudden we're at a really, really high risk of dementia. So I want to encourage you guys, anything you can do to improve your sleep, they call it sleep hygiene, but anything you can do to improve that, including working on your bladder, all those things are going to have a dramatic impact on you. I'll mention just a few little things that you can do now. I shouldn't say little. Magnesium at nighttime, we mentioned that earlier. Getting light during the day, specifically sunlight during the day. Dimming your lights at nighttime. Not exposing yourself to blue light exposure like screens from phones, from TV at nighttime. So kind of rising when the sun goes up, going down, it's all part of your circadian rhythm. Optimizing hormone levels, including melatonin, and so oftentimes I will recommend melatonin for people. It's a really strong anti-inflammatory, and there's data that it helps people to sleep better. There's also some other sleep medicines, supplements that I recommend, GABA being one of them, that relaxes the mind. So if you struggle with, I lay down but I just can't go to sleep, GABA. And then some people are taking that, if they have to get up to go to the bathroom, they'll take GABA in between that. Okay, jumping on. Number 4, decreased productivity. And so this is a really common thing. I think I've mentioned this, previously. But one of the, favorite examples I have of this is a gentleman who was suffering from a bladder problem, and he had overactive bladder and he had frequency. So he had the urge to go all the time. And so he worked on it. He did all kinds of things that he could do, but nothing really seemed to work. And he suffered from this for years and years and years. In fact, he had this even when he was kind of younger. So he was in a high-level job where he had to splice in TV commercials during live TV events, like sporting events, any kind of live filming, those kinds of things. And so you can imagine if you felt like you had to go to the bathroom, or you had to go to the bathroom every 30 minutes, what would your quality of life be like at work? What would your productivity be like at work? Do you think you would be getting the job promotion? Or do you think you might be getting the talk with your boss, like, hey, why are you missing this? There are some scenarios where you just can't miss it. So there would be, he didn't know when the commercial that he was going to have to insert in the, let's say, basketball program would be, but only when the team would call a timeout. So there was like no window where he could plan to go to the bathroom. So he's one of my great examples of, we were able to treat him and drastically improve his symptoms. And he said, like, really, he felt like for the first time in his life, he felt like he had control again and wasn't at the mercies of his bladder sending all these signals that it was time to go and he had to go right now. Okay, the next one, the next danger number 5, is the medication side effects. Most people do not know these. Most physicians, most nurse practitioners do not know how dangerous the side effects are from overactive bladder medications. Now, I will say when I, started educating doctors about the dangers of these kinds of medicines, they didn't know at all. And I will say now when I start to talk to people about the dangers, specifically of overactive bladder medicines, a lot of them understand what the dangers are, at least the big ones. And I'm going to tell you what those are. So when we're dealing with medications, kind of the first thing we always think about is how efficacious is it? So how many people, what percentage of people will get a benefit from taking this pill? And that's really important for us to determine if this is a good medicine for you. There are basically kind of 2 different classes of bladder medicines, and I'll just generally say they're the older kind and the newer kind. The older kind, they have a number needed to treat, and so again, this looks directly at how efficacious they are, but they have a number needed to treat of somewhere between 8 and 12. And so what that means is if you, let's say, are on oxybutynin for your overactive bladder, I have to treat or give prescriptions to 8 different people before one of them does well with that medicine. So that number needed to treat is actually 8. So the flip side of that is 7 out of 8 people don't do well with that medicine, or it's not efficacious for them. So that just generally means these are highly unefficacious, I don't know if that's a word, unefficacious medications. Then there's the newer class. And so remember, we're just talking about efficacious, and then I'll talk about side effects. And I mentioned that as one of the risks. Newer class of medicines, and so there's really 2 of them, Gemtesa and Myrbetriq. They're both non-generic, so they both can be quite expensive for people. But the number needed to treat on those is about the same. It's about 8 or 9. So for most people, even though they're brand new, they work in a slightly different way, they're very expensive. For most people, they don't get the job done the way that people need it to be done. Okay, so that's one thing. That's the efficacy. The next thing we're going to look at is side effects. And so side effects for the older medicines, the number one thing you have to know is the older medications drastically increase your risk of dementia. And so we think they increase your risk of dementia by 150%. The number 2 thing that you need to know is they drastically increase your risk of falls. So they increase your risk of falling and getting like a fracture by about 300%. So remember, we said that was the most deadly thing if you were 65 and older. So they also increase your risk of feeling dizzy, confused, hallucinations, drowsiness, dry mouth, dry eyes, constipation, bladder retention, so on and so forth. But those are the biggies why I think there's very few people who should ever be on these medications long term, at least the older class. The newer class, doesn't have some of those nasty side effects, but it has its own kind of slightly nasty side effects as well. Its big one is it can affect your heart and it can cause heart arrhythmias. So again, that's something that all of us would like to avoid. We don't think it increases your risk of dementia, but it can affect your heart. Obviously, it can cause dry mouth, dry eyes, those kinds of things as well. Okay, and then there's huge studies on these bladder medications and if people can tolerate them or not. So medication side effects, one of the dangers of overactive bladder. Interesting thing, huge study looks at about 43,000 people who are prescribed these kinds of medications and follows them over time. What do you think happens? I'll tell you, 85% of people quit these medicines because they don't work and because they cause all kinds of terrible side effects for those people. So again, that's one of the big risks for this condition. Okay, we're getting on the downside here of this discussion. So we're at number 6 out of 7. So number 6 is skin breakdown and infection. Frequent urination can lead to skin problems and infections, and proper hygiene is key here. But not only is it just frequent urination, but really it's oftentimes related to accidents and having that wet up against your skin. And all of us probably remember babies with diaper rash. And so that's a really big problem for people. And as we age, our skin becomes less robust. The collagen in it becomes less robust, and it tends to tear, get small infections, even more so than like a baby's skin. Okay, so one of the things that we can see, especially for people who aren't moving as much, is you can develop skin ulcers or skin breakdown. And so obviously that is a massive problem. I talked about infections too. If you have overactive bladder, that urine that comes out of you and stays against your skin can also lead to infections. And so those oftentimes are treated with antibiotics. Sometimes if it's a fungal infection, antifungals, those kinds of things. Those things obviously have their own set of side effects. And now we know even the use of antibiotics, even short-term use, really affects your gut health. And if we affect our gut health with antibiotics, all of a sudden that creates all sorts of other problems. There are overactive bladder. You're going too many times a day, and your bladder is kind of firing all the wrong signals. There's something else that's similar, like underactive bladder, but it's called urinary retention. But you're just not getting a coordinated effort. And so we'll see this also with some people who have a combination of these things. If you don't have a coordinated effort to release the urine from your bladder, oftentimes that predisposes you to urinary tract infections. Urinary tract infections can be quite dangerous if they spread systemically, and obviously can lead to what's called sepsis and then even death. Okay, you might be saying, where's the good news here? I told you this is the 7 hidden dangers of overactive bladder. So number 7, so we're on the last one. This one is another kind of one that's affecting your emotions, but it's depression and anxiety. So living with constant fear of urinary accidents, of embarrassment, basically leads people to be in this heightened aware state that leads to things like anxiety and depression. So there was a study published in the International Neurology Journal that linked living with overactive bladder with a much higher risk of anxiety and depression, exactly what we're talking about. And all of us, our mental health, I feel like for all of us is kind of always teetering on the edge, and anything can push us one way or the other. But health challenges are one of the most common things that can push us one specific direction. Living with overactive bladder for most people can be exhausting. It's continuous. It doesn't give up, and it just keeps going and going with embarrassment, frustration, not being in control, all of those things. And that just leads to a much lower quality of life. Like we mentioned, people can start to withdraw socially. and that definitely can lead to depression and anxiety for people. The other thing that affects this, we've already talked about it, is sleep. So if you're not sleeping good, your risk of depression and anxiety are much, much more dramatic. And then we didn't even mention the side effects from medications, but obviously those can lead to these sorts of things as well. Okay, so I think the important aspect of this is we really need to recognize the psychological impact that overactive bladder has. Okay, so I'm going to go through those 7 again, and I would love to hear from you guys. What has affected you? Did I miss one of them? And I certainly might have. Number 1, social and emotional aspect. Number 2, falls and fractures. Number 3, poor sleep. Number 4, decreased productivity. 5, medication side effects. 6, skin breakdown. 7, depression. I'm doing my fingers on depression and anxiety. So that kind of ends it for us. Now, let's see. The one thing that I will talk about, so, that was a doom and gloom sort of message. You might have the question, well, what should I do? That's like not very encouraging to know. I already know all this stuff. I'm already suffering with all these things. Our main message here is hope, and then kind of our tagline is free at last. And we want you to find that personal freedom where you feel like you have control over your bladder, if it's affecting your bowels, over your bowels as well, and that you're able to live the life that you've kind of dreamed of and worked really hard to live. And we know that overactive bladder in particular is a thief that steals your quality of life. I specialize in sacral neuromodulation. It has a 93% long-term success rate. It's the most successful thing that's ever been designed or developed. At 2 years worth of research, so there's been research studies in America and in Europe, but at 2 years, 94% of people were satisfied with their therapy. We see that exact same thing in our practice. And then one of the things they look at is clinical meaningful difference. So in the research study, what they look at is really how does this affect your quality of life, your coping skills, your concern, your social, your sleep. They look at all those things, and we can tell if any intervention, if you have a back surgery, how does that affect your quality of life, a knee replacement, hip replacement. But we've looked at this, sacral neuromodulation. How does this affect your quality of life? It not only improves, so they've broken it down on a numeric score. And so if you have a 1-point bump, basically that, it's 10 points, that means it's clinically significant. It will really improve your quality of life. The technology that I'm talking about, what we specialize in, actually has a 3 times bump. So that means not only you get 10 points, but you get more than 30 points on average. So what it means for people is their lives are massively different and massively better. I like to always try and tell a tiny bit of a story about maybe somebody that we've been kind of treating. And so I'll mention one lady. Obviously, I'm not going to use her name. But this lady that we recently treated, her main issue was urinary urgency. And then she also had a bowel urgency and some fecal incontinence. And so she just came in. On what we do, there's 2 steps. There's a trial to see if this technology works for you and your condition. And then 2 weeks later, we do something called the implant procedure. We place this system inside your body. So she was doing the trial just to see, is this going to be the right therapy for me? And I am happy to report that she said, she came in yesterday, she said she had a 99% success, which is hard to beat. Her urgency was reduced down drastically. She wasn't having accidents. She felt like she was in more control over her bladder. As far as bowel movements were concerned, she used to have more than 6 per day. She went down to 4, but they weren't out of control loose where she was having accidents. So she was back in control. So for us, that is a massive win. For her, this is going to be absolutely life-changing for her. I would love to hear your comments, questions, And I hope that this is your year to get the help that you need. We are here in Phoenix, Arizona. I specialize in this particular procedure. We do more than anybody in the country. I love it because it's such a big quality of life booster for people. And I hope this is an amazing year for you. Thank you so much, and God bless you.